Hi, my name is Dr. James Reade, chiropractic physician and certified functional medicine practitioner. So we're briefly going to mention about heartburn, okay? Pretty common thing and pretty frustrating. Is it just the answer, just a pill? Maybe not, all right? And again, what we try to go ahead and do here at our office, we try to go ahead and take a look at this thing from a functional medicine standpoint and try to get down to the root causes of some of these different issues. Now, of course, one of the things that can actually happen is that there could be some irritation of the lining of the stomach. It could be due to actually an overgrowth of a bacterium called H. pylori. There could be some other things that are causing some inflammation of the lining of the stomach. The other important thing to keep in mind too is that with your digestive tract, it's a very intricate, balanced type of machinery that takes place, and your different organs communicate with one another. And what do I mean by the different organs? Well, the stomach communicates with actually the pancreas. Pancreas communicates with the gallbladder. Gallbladder communicates with the stomach, back and forth, and even the small intestine. So making sure those lines of communication, the hormones are being released at the right times and so on, crucially important. And if the lining of the stomach, for example, is irritated, maybe some of that communication could be interfered with. You may be deficient in certain nutrients, like zinc is very crucial for the proper production of pancreatic enzymes. It also is important to maintain the health and lining of your stomach, also the proper production of acid in your stomach. The type of food you're eating, can also be an irritant. You might have a food sensitivity. It could be gluten. It could be, the traditional spicy food, coffee, some of these other things that could be irritating the lining of the stomach. So that's where, doing a functional medicine evaluation to see what is going on there could be an issue. Additionally, I'm a chiropractic physician. So I'm going to take a look at things also a little bit differently. And did you know that a lot of times heartburn can be due to actually a problem with what we call a hiatal hernia? Now, what's a hiatal hernia? Sounds kind of weird. Does that require surgery? No, Most of them are called, sliding hernias. So you do not require surgery. There are some cases, yes, that you may have to get surgery, but most of them, no. Now, what is it, Dr. Reade? Well, I'll give you a little anatomy and try not to put you to sleep, but I think understanding some basics is important. So there's actually a little muscular sphincter or area in the lower portion of what we call your esophagus, which is that tube that goes from your mouth to your stomach. There's also another huge muscle here that helps you to breathe, and it's called your diaphragm. Now, what's interesting, this muscular ring here at the lower portion of your esophagus, what happens is that the diaphragm should also be surrounding this little lower esophageal sphincter. When it's not, if the diaphragm is off here, you're not having that full ability to close off the lower portion of your esophagus. This can allow some of the contents of the stomach to pass through, especially and you have to remember, your stomach churns quite a bit. People don't realize that. We don't feel it, but that's what's happening when you're digesting your food. So that mechanical irritation, if you only have, partial closure ability, that can be a problem. Now, what can affect the diaphragm, Dr. Reade? Well, there may be a problem here with the diaphragm itself. It may have to be physically worked on. Another interesting thing here, the diaphragm, I'm going to turn around here, parts of the diaphragm attach right to this area here in your back. We call it the thoracolumbar area. If there are misalignments there, that potentially can affect the alignment or the attachments here of your diaphragm. Another interesting thing is here in your neck. There's a nerve, it's called the phrenic nerve. It actually comes here from about the fourth cervical vertebra. It also influences diaphragm function. You may have problems here with the alignment of your ribs and your mid-back area and your vertebra. that can also influence the diaphragm movement. There's also an area in your mid-back here, and those particular nerves can actually have a direct effect on some of your organs in your, such as your stomach, your pancreas, gallbladder and liver. All right, some of those nerve outlets potentially, not all the time, but potentially can have an influence in some of this as well too. So, and one other thing I wanted to mention here, at the base of your skull, there's another nerve called the vagal nerve. And sometimes that can be affected when there are some misalignments and problems here along the occiput or the base of the skull. It can cause some tension as the vagal nerve, enters and exits the base of the skull, which is interesting. So from a mechanical or chiropractic standpoint, these things may also have an impact on heartburn, and something that actually should be evaluated as well. And again, at our office, we try to take a look at the whole person and realize how we're interconnected a lot of times. And this is why we do the functional medicine, and the functional medicine could direct us to, hey, you might actually have to do some, spinal manipulation or some chiropractic treatment too, and physically work on some of these different areas that potentially can cause a hiatal hernia and be one of the things that could contribute to heartburn. So I hope this information helps you out, gives you a little bit more things to think about, about heartburn and hiatal hernia. And of course, I hope I explained a little bit about this to you. If you're interested in getting an evaluation and having a functional medicine or a chiropractic, or have both, because we do both here at our office, give us a call at 480-732-0911. And one of my staff members will be happy to go ahead and schedule a personal appointment. Once again, thanks for watching, and best of health.